All right, here we go. Well, hello, everyone, and welcome to the Heartland Daily podcast, where once again we're going to be talking about the latest developments in healthcare news. My name is Anne Marie Schieber, and I'm the managing editor of Healthcare News, which you can find at heartland.org. And joining me is once again Devin Herrick. Devin is a healthcare economist who posts at the Goodman Institute Healthcare blog, writes a lot of good stuff, which we often chat about. Welcome, Devin. Good to see you again.
Good to see you.
Well, we've got a mixed bag of topics to talk about this week. Issues regarding health insurance, the Medicaid cash cow coming to an end, no more immigrant health care that was bringing in a lot of money to states. We're going to talk about the heat wave that socked most of the country last week and why that's a health hazard. And a fun topic at the end, whole milk not being the villain that it was once purported to be, thanks to Maha. So we will find out a little bit more about that. But first, I want to jump right into this issue of prior authorization. That was probably the biggest development this week with HHS Secretary Robert F. Kennedy and Mehmet Oz, who is the administrator at the Centers for Medicaid and Medicare Services. They announced not a rule, but an agreement involving the health insurance industry on something called prior authorization. Now, doctors complain about this, patients complain about it. It's a gatekeeper system, and it can be very onerous. Because insurance companies want to be able to approve everything that they're going to cover. And when you're working with a specialist and they order a lab test or a diagnostic procedure, you oftentimes have to get that approved by your insurance company before it will be paid for. So, and these could be big bills. So you want to make sure that that happens. It creates a lot of paperwork and time for doctors' offices, and they have to hire extra staff to work on this kind of thing. And so Kennedy and Oz are well aware of the complaints about this and decided to go in a way that they've done for other things, not really creating a rule or, slamming down the gauntlet, but they got the insurers to get together and agree to a systemized procedure in doing this. And I think the idea is if they don't do this and get better on it and kind of streamline things for patients and doctors, there is going to be a rule. Kennedy did this with the food makers and on food additives. He didn't create a rule, but he basically said, and this was with Martin Macri and the FDA, that they got everyone to agree and they're going to have voluntary compliance, which is always a real good way to go. Because of course, who wants extra regulation? But, practices, sometimes that has to happen so everyone's competing on the same page. Devin, you recently wrote about prior authorization in a blog post. Maybe we can pop that up here. And it's a story you've told once before regarding your wife and how actually prior authorization can be a good thing. You want to talk about that?
Yeah, sure. Of course, prior authorization is often used as a rationing tool, as you can imagine. And where, let's say your doctor prescribes a really expensive drug and your insurance company says, no, before we give you that expensive drug, you need to try the cheap one first. That's called step therapy. It's very irritating if you really need the expensive drug, but you can save money over time if you actually don't. But what happened to my wife was that she went to a doctor. Her doctor wanted a CT scan. And they didn't really know anything about, my wife was not knowledgeable about health economics. And so the office clerk said, well, is there any place you would like to get that done? Well, my wife just thinks, oh, I drive by, Baylor healthcare system every day. So why don't I stop there? Well, a hospital is the most expensive place to get anything done. Because it was expensive, the Baylor outpatient had to get, prior authorization. And so, like the next day, they called and said, "Okay, Blue Cross of Texas has approved the procedure. We can schedule it now. Just know your share of the cost will be 2,700." Well, of course, she freaked out and told me the story, and I'm like, "Well, why would you go to a hospital for a CT scan?"
Yeah.
So luckily, she hadn't gone yet, and I just used Google, and what's really funny is I found a freestanding radiology clinic that advertised the quote Blue Cross price. And it was literally within walking distance of her doctor, the one who had ordered the scan. And
Yeah.
I'm like, well, why don't you use this place? It's $403, and that's the total price. And so she did, and she told the doctor that story. But it was, essentially it was because she didn't know any better. And they had given her a choice. Well, where would you like to go for this test?
Right.
And she thought she was picking convenience. She was actually picking costly because the place she went was equally convenient. It was literally a stone's throw from that doctor's office. And so the next time she needed a test, she told that doctor, okay, what is around here that is economical? And the doctor had some ideas, believe it or not. So, but I guess the point was people complain about prior authorization, but in our case, it saved, 2,300.
Right.
And I have a doctor that has literally said that on his website. We may have to seek prior authorization, but this is a way for you to know your cost sharing.
Yeah.
And I'm
Well,
thinking, well, what a great idea. Why can't we get that information without having a cumbersome process?
yeah. Well, it's a symptom of the problem of health plans and third-party payers and people being abstracted from the cost. They don't pay the cost directly. Now,
Mhm.
today, they are with copays and they are on the hook. But, it would be great to spend that time instead of having your doctor make all these calls and get approval, that maybe the insurers could work a little more closely with consumers in finding the best cost. You know who does this really well? Direct primary care and health share ministries, because health share ministries are not really, they're not insurance. They pay directly for services. People pay membership fees. And they, of course, are very interested in finding the best service out there for the lowest cost. So they will actually help work with patients to find super inexpensive and good quality services and medications and such. But
Yeah,
again,
it's a great
like
idea.
yeah, healthcare prior authorization is a symptom of a larger problem, and I appreciate that. Administrator Oz and Secretary Kennedy are cognizant of this problem and have taken steps, and the insurance companies seem to be working together. We shall see. I hope that they get a better system in place. No doctor's office wants to, we shouldn't be spending doctors' time doing this stuff. It's more administrative work, it's less time with the patients. So I applaud this. Nice work, but more needs to be done.
Well, and I've talked to doctors, and a lot of doctors I've talked to said, oftentimes it's for little things. It's for a standardized care. It's typical care that's not exceptional, not expensive, and it's approved, 80, 90% of the time. Well, if it's approved, if it's standard stuff and approved most of the time, it really shouldn't be part of the prior authorization. I mean, I can see getting a $3,000 CT scan. They should have required prior authorization and then sent an email to my wife and said, why don't you pick this place off I-75 near Walnut Hill?
Yeah, right.
Would that have been nice?
Well, I don't know, Ian, if we can pop up the HHS press release. It talks about, maybe go back a little bit. This one is labeled, what is the tab here? HHS Secretary, right before that. Yep, there you go. They outline, there's a couple of bullet points of what they're going to agree to do. I won't read all of them, but some of them are, they're aimed at reducing the volume of medical services that are subject to prior authorization. to honor previous authorizations, so you don't have to keep going through the process over and over again. Transparency, better communication, real-time responses. I've heard complaints about there being a lag. And basically, sometimes that is a way to gatekeep services and ration them through waiting, and people give up and find alternatives. So that seems like it's going to be addressed. And medical professionals are going to be making these decisions, not administrators who may not be cognizant of all the medical issue concerns. You mentioned in your blog post about artificial intelligence, AI, and maybe that would be a very good way to use AI to make these decisions, save some time, save labor, and maybe expedite this. No one, the insurers have to manage their costs, right? They have to be solvent. We can't run them to the ground. And so they're just doing what they need to do. But yes, it could be better.
Well, and I conclude by saying, well, maybe this would not be objectionable if it really was done for the benefit of consumers. Like in my example, I wonder, why didn't my wife's health insurance company contact her and say, you're going to the most expensive place imaginable and you have not met your deductible, so you're going to pay a ton of money. Why, if prior authorization helped consumers, worked with consumers, they'd be a lot happier about it, and they'd accept it, and it wouldn't be controversial, I guess, is the point.
Right. Yeah, I agree. All right, let's move on to the next topic. This was an article that was in Discourse. I don't know if we can pop that up, but it's called Ending the Independent Contractor Debate. And this was written by Jarrett, I'm not going to say his name correctly, Dieterle from the Manhattan Institute. And he says it's time for state and federal lawmakers to embrace a portable benefits model, which will both preserve the flexibility of gig work and protect individual workers. Now, let me back up what has happened. Gig workers are now becoming a really big part of the economy. People are finding sources of income without having to work for big employers, small employers. They're contractors. They make decent income by picking up contracts. The only issue with that is because in the past, employers were seen as the primary source for healthcare. And now gig workers have to go out on their own and find healthcare. And what California tried to do 5 years ago, and it failed miserably, they did this in a legislative action. They forced gig workers, the companies that hire gig workers, to pay for the healthcare benefits. It was a total mess because gig workers, first of all, are in and out of the employment system. They may have a contract, they may leave. And, to get somebody online for a health insurance policy, there's a lot of cost and time associated with that. And employers are just going to say, forget it. We're just not going to hire contract workers. We're just not going to do. What happened in California is not only did gig worker employment drop, but regular employment dropped. And so it was a disaster. They did end it, but still there are states like Illinois, New Jersey, I think Oregon, Washington, are blue states that are still trying to or considering putting these measures into place. I will tell you, I am a gig worker and I have never had a better healthcare setup in my life because I had to freelance it. And I discovered that there are ways to cover yourself that are even a lot cheaper than an employer plan. Employer plans today cost money. They are your compensation that, by the way, your employer is taking your money and spending it as they see fit. Now they get a big tax incentive to do that. They don't have to write payroll tax on that compensation. That's called the tax exclusion. And there's been a big argument about getting rid of that because it has done it's had a ton of bad consequences in the healthcare sphere. And I would be all in favor of that. Employers will go kicking and screaming, but it's led to very expensive healthcare plans, for example. And it leaves people who are gig workers out in the cold. And there's been discussion by, people like Rep. Chip Roy and other conservative reformers in healthcare who think it's time that we expand health savings accounts, give gig workers an alternative so they can enjoy the same tax benefits as corporate America employees. So they can buy their own healthcare, shop out their own products. They'll probably find cheaper stuff. And here's what will happen. We'll get better stuff. We'll get better suppliers because there will be a demand for it now. So what is your thinking on gig workers and making this a one size, just kind of making more equity in the healthcare sphere for worker employment, healthcare?
Well, John Goodman has talked for years and years about the need for personal and portable health insurance coverage you could take from one job to the next. And a gig worker is the perfect example. And I think the problem that we run into is, a lot of the blue states, they don't really want to solve the issue in a way that is flexible. They want, they don't believe in gig workers. They believe gig workers should be hired by, DoorDash and hired by, Uber and Lyft and be full-time or to be full-fledged employees. So it's like a lot of these states are throwing up roadblocks purposely, and they don't want to solve the problem. And if you think about it, I mean, a lot of Lyft drivers they can pick their schedule, they supply the car, they can decide if they want to go to the airport or if they want to just make runs locally, if they want to be the designated driver for baseball, football games and the like. And so, I mean, it truly is a gig. It's a flexible job where you are an independent contractor and you may work 10 hours a week and you may work on weekends only, or maybe your full-time job, and they need the flexibility to have health coverage that meets their needs and not Obamacare, which could be outrageously expensive for a lot of them. They need more, and we all need more flexibility, but especially if you're, delivering groceries or, DoorDash or making airport runs or what have you. I mean, it really is the wave of the future. A lot of people like picking up a little extra work. And it may just be, where your friends go out Saturday night and party, you go out and drive people who've partied, home for money. So it makes a lot of sense.
Well, it's interesting how it's the blue states that are pushing these measures, and they are under enormous pressure from labor unions. It's much harder to organize gig workers than people that work for big companies. And that has always been the driving force. When the gig workers first started coming on the scene, Uber and what was the other one? You don't hear so much of it, but the housing, the one where you can get Airbnb, right? They were really under attack from local governments, state governments in blue states because they were harder to control. They were harder to tax, harder to organize. And so and then of course, they're heavy regulated states, and it's really hard to push regulations on independent free flyers, right? So I think they need to get with the times. It's, it's only 5 states. Eventually, what are they going to do? Be the only ones left standing? I'm hoping that, there's something done at the federal level that incentivizes states to allow a gig worker economy. It is the way to go. And with technology and AI, it might be our saving grace. So I'm just all hands.
This was, I don't know, a few years ago, I was in Washington, D.C., like I have to do occasionally. And I had to take a cab, and it's highly regulated, as you know. I mean, it used to be if you went around the Capitol, that was like 5 different cab zones, and it could be outrageously expensive. But my driver was a Syrian guy, a refugee, and he said, yeah, I used to own, I don't know, like half a dozen cabs. but he sold them all. He only had one, and that was his. He was driving. And so I said, well, what do you think of Uber? He's like, oh man, that's why I sold my cabs. It wasn't that I couldn't compete with their service. I couldn't get drivers because all their drivers went and worked for Uber.
Wow. Well, remember the cab cartels in New York City. I mean, cabs were so expensive before Uber came on the scene. And to drive a cab, you had to buy, I forget the name of it, but it was a license.
Medallion, yeah.
Medallion. And these were like thousands of dollars. And of course, you're going to need to charge really high fares to make that money back. And it became a kind of a cartel, a racket, where there were just a set number of these. It was to control the market. And once again, technology upends heavy government regulation. There's a better way to deliver service, and they're left standing there. And I know there's going to be some remnants in there and some, big pressure still in these blue states to continue things the way they used to be. But in terms of healthcare and independent contractors, it's time we get with the scenes. And I really hope that the current administration takes a look at that and gives gig workers a few more choices when it comes to getting healthcare. All right, let's move on to the next topic. This is something you blogged about this week that was on everybody's mind. So we are recording this the last week in June, and this entire week, it was about 90 degrees plus in every state of the country. It was really, really hot. And I just kept thinking I'd go out. I live in Michigan. Devin, you live in Texas. You're kind of used to these temperatures. I kept thinking, oh my goodness, how do the people in Texas deal with this every day? But, the thing about heat is it's a health hazard and you need air conditioning. Air conditioning was an amazing development. Think about it. It's been around for, my goodness, 50, 60 years. And I know that it's been under fire for a variety of reasons, climate change and whatever. But why don't you talk a little bit about what you wrote here, Devin, and what prompted you to say what you did?
Well, as you say, a lot of progressives and climate activists think that air conditioning is the enemy. I mean, Americans especially are prone to have air conditioning, unlike Europe. And, they think that our desire to, like I'm in a room, my office right now is probably 72, 73. And our desire to be comfortable when we sleep at night and to be comfortable in our office and to shop in stores, or, to go about our daily lives in ways that are not, overheated and sweating is selfish. Well, it's not just some luxury where we're burning the planet by running the air conditioner. It really is a health issue. Right. For example, I think I wrote about in 1995, there was a heat wave in Chicago that killed, I don't know, like 700 people, 739. And you were something like 80% less likely to die if you had an air conditioner compared to if you didn't. And then in 2023, there was a heat wave in Europe. Air conditioning is not nearly as common in Europe as it is in the United States. And it killed like 60,000 people, so they think. And I mean, going back 20 years before that, there was a heat wave in 2003 across Europe. And the article I read said about 15,000 people in France alone died from heat stroke. Wow. A lot of those were in people, shut-ins, people that were in nursing homes that weren't air conditioned and so on. So when we talk about the ability to cool our surroundings, it isn't just a luxury. It's, it is a necessity in some cases. And you don't have to cool your entire house. When I was in Costa Rica, I've been there, I don't know, like a dozen times. They air condition the bedrooms typically, and the dining room, living room may be open air, in fact. In fact, in the hospitals, I toured hospitals. And the common areas were not air conditioned in San Jose, Costa Rica. But then again, they're like 4,000 feet high, so it doesn't get that hot. But the patient rooms were. So, yeah, and I mean, there various research has found that you're more productive when you're not overheated, you sleep better, and you're less apt to die of cardiovascular events and many other health problems.
Yeah. This just makes the case even stronger for, the people that probably don't have access to air conditioners, or maybe people who live in older rental units and they are lower income. They may not have the ability to purchase air conditioning. And this just makes the case. I'm sure, we have 1 in 5 people on Medicaid. This just makes the case to consider an HSA for Medicaid enrollees. So that, let's say, instead of giving $8,000 to a managed care company to let them see fit how they're going to spend money to take care of you, give that money to an enrollee, and then they can spend that money on something that would be approved. And certainly you could make a case for a portable air conditioner unit. You can probably get one for a couple $100 to stay cool. And what do they call that? Health determinants of healthcare.
Yep, social determinants of health.
Right. We were talking about that in the last administration, and how they wanted Medicaid to pay for rent and pay for transportation and get rid of pollution in the neighborhood, all good things. But, at what point do you stop? And it's much better for people to make their own determinations about what's good for their health. The other thing too is affordable energy. People don't run air conditioners when the energy prices are very high or when they're brownouts. Okay. So our utility companies, instead of, experimenting with trying to find alternative sources of energy, maybe they should just focus on getting affordable, accessible power when they're huge, the demand during a heat wave comes and we start seeing brownouts. That's just another thing that we need to focus on. All right. Well, I guess we solved the health, the heat wave.
I'm not sure if we solved it, but we.
Right. We're going to get another one. And we haven't talked about it could be a cold wave too. We've had those too. So we do have extremes in temperature, and it's just something to keep in mind. Our next item I want to talk about is Medicaid. Now, as we talk, the U.S. Senate is still hammering out what the One Big Beautiful Bill is going to look like. Medicaid has been a source of where a lot of cuts are going to occur, and there's a lot of pushback on it. But one of the things, of course, is we're going to limit healthcare for people who are here illegally in the country. And that is going to save a lot of money. I want to pop this up because I just stumbled upon this. If we could pop up this article, States Brace for Job Cuts. Now, I don't know if that's available. This was an article, there we go, in Becker's Hospital Review. And it talked about the states. These are healthcare job losses that are going to occur with the Medicaid cuts due to the cut in illegal immigrant healthcare. And you could see this is just incredible. No wonder these states were fighting to the grindstone to protect Medicaid for illegal immigrants. California is projecting over 77,000 jobs will be cut as a result of this. So, I mean, you can see how expensive this has gotten. New York, 51,000, Texas, over 20,000. These are the states where, we were spending a lot of money taking care of these 13, 15 million people who are in the country illegally. And while that's a separate issue, this is a cash cow that's going to end. And, it was very controversial. Some states are really cutting back. You wrote a blog post on this. I don't know if I have this up, but didn't you wrote a blog post on this about Medicaid really reforming because this was such a big cash cow for states. And why
what a lot of states, jumped on the bandwagon, California famously, but there were others. I think, I forget, Illinois, I think maybe Colorado, and they're possibly, I don't know, Minnesota. I forget now exactly all the number of states. Yeah, Minnesota. But anyway, some states jumped on the bandwagon about we need to provide coverage for illegal immigrants. Well, the only coverage that a undocumented worker qualified for would be emergency Medicaid, which is really the same as anyone who goes to the ER. If you go to the ER and you need to be stabilized, the hospital had to get you stable. Um, but but as far as that, illegal immigrants did not qualify for full-fledged Medicaid health plan type coverage. Well, some states decided to expand Medicaid, and of course they were trying to get all the matching funds they could, but in some cases they had to provide their own funding.
Hmm.
Well, what they found was that it was very expensive. I think it was Illinois thought, oh, it's only going to cost 112 million or something. Well, it cost 800 million.
Wow.
So a lot of or virtually all these states began to backpedal. Plus, the Trump administration said, no, we're going to scrutinize spending. We're not going to pay for all these, various beneficiaries, not just undocumented workers or illegal aliens, but the Trump administration indicated that it would begin to scrutinize more closely because, states had enrolled a lot of people during COVID. Some of these were no longer eligible, and states have never been very aggressive about, making sure people who enroll are continually eligible. Well, now with states on the line and thinking, wait, that's our money. We can't afford this. They're having to cut back. They're having to scrutinize and roll back coverage. And I think California even suggested making or freezing enrollment, not adding any more, and making the existing enrollees pay $100 a month towards their coverage. Well, that'll be interesting to see because I suspect most of those will drop coverage if they have to pay even $100 a month for Medicaid. But it'll be a good natural experiment to see what happens, and probably an embarrassment to California when they find out that people don't like their coverage enough to even pay a fraction of its cost.
Yeah, well, I mean, that's what California made this decision maybe 4 or 5 years ago, and they started broadening who they were going to cover. First, it was emergency cases, illegal immigrants, and then it was, I think, senior people, pregnant women. And then before you know it, the umbrella was just wide open, covering everybody. And, the federal government in expansion states pays 90% of the bill. But you're right, states have to come up with 10%. And my goodness, when you're talking $800 million in Illinois or whatever, that is a big chunk of change for states. And you can see where they're going to be on the hook for this, especially if they go down to a lower reimbursement rate. And then, the problem is Medicaid was always designed to be a safety net program. And we have truly disabled people who need Medicaid, who are unable to work. And, pregnant women, it was always for the disabled population, the developmentally disabled, and they are reimbursed. The states are reimbursed only about, I think it's 65% for those cases. So you can see why states are really pushing expansion. It's not fair to the states that don't have expansion because they're at 65 and they don't have everybody under the sun covered by Medicaid. So I think things are really going to change here. And these states that are losing, you could just see how much of an impact that has had on the healthcare economy by this system. And it's kind of a falsely created government system that propped up all these jobs, and now they're going to be lost. And that's why it's so expensive to cover this population, but things are changing, and I guess we'll see.
Well, and of course the left oftentimes throws out, it's not, Medicaid is not a jobs program. Neither is Medicare, neither is a lot of other entitlements. These were never meant to be jobs programs.
Yeah.
These are meant to be a aid to needy people. And I've said this for years, Medicare should not be in Medicaid. We're talking about Medicaid, but Medicare as well. it should not be an entitlement for hospitals and for drug companies and for, if you find a pharmacy that is abusing and creating fraud, they should be kicked out forever, kicked out of the program forever. And I don't see why well, I know why, because they run to their local representative and, oh, you can't kick this company out. Well, why not?
Yeah. Well,
they're
I mean,
abusing the system.
the debate in the Senate is over what can come under this reconciliation bill, and they're now looking at these provider taxes, which was going to save Medicaid a ton of money. What happens is the providers, the states, charge providers like nursing homes, hospitals a tax. Then they submit that into the federal government, get that reimbursed, and then they give that money back to the provider. It's what they call Medicaid money laundering. And there's a big debate in the Senate whether this can fly. They want to try to ban this. And it's up for debate now whether that is a fair item to tackle in reconciliation. So we will see. We're talking, lots of money there. And
absolutely.
not related to the immigrant issue, but you can see why it's so difficult to cut Medicaid and why you always need to think twice about passing spending programs, because it's almost impossible to get them. So many people are entrenched. There's so much lobbying against it. And, we just need to finally get used to this. Free markets. All right. Last item.
I read about that today. So, in fact, and I think my takeaway was states complain, oh, you can't do away with provider taxes. We rely on those. What if the feds had their own program where they said, oh, we're going to start taxing your hospitals, and then we're going to give that money back as our share of our matching funds? Well, we know hospitals and states would scream because it's a fraud. Well, it's also a fraud when states do it.
The thing is, you will spend what money you get, right? You will change your system. You will spend every penny. And then when you try to take away that money, people can't move, right? That's what the hospitals do. That's why they scream when we try to get to site neutral payments. That's another issue in Medicare, where we pay hospitals more money to provide a service than maybe somebody independent down the street can provide it for. And it costs Medicare lots of money to do that. The hospitals say they have to have that money. Otherwise, they can't run Medicare. Well, once again, they will design their systems to accommodate whatever money comes in the door. And then it's very hard to change it when you got to start making budget cuts. So don't pass it. Yeah. Stop spending. All right. Last item on our list is whole milk. I'm so glad this issue came up because, it came up in the MAHA Commission report. They mentioned whole milk, and in the schools, I don't have kids in school age kids, but I remember even my kids growing up, it was reduced milk. My kids didn't like milk. And I think probably one of the biggest problems, milk is not a bad thing, right? That's what's mentioned in the MAHA report. It is a wholesome food. Kids need fat. And, taking a look at whole milk, the calories are not that much less in reduced fat milk. And it tastes like water, and kids don't like it. And then they don't drink milk. And then what they end up doing is drinking other garbage that's energy dense or that's calorie dense, but nutritionally, empty. And they start drinking juice and soft drinks. And if we gave them a couple of glasses of a whole milk a day, they would like milk. They wouldn't need to drink so much milk, and they'd be better off for it. And now MAHA is taking a look at that. And maybe we're going to start seeing whole milk now back in school lunch programs. You have any thoughts on that?
Oh, I drink coffee, and for the longest time, I only bought like heavy cream and half. I didn't even buy whole milk. Was too devoid of fat for my taste. Now I do buy it to make creamers with, but yeah, my house we've never had fat-free items because they have no taste and they're not any healthier than
You,
than
you you're better off eating much less of the good stuff, right? The high
yeah.
fat stuff than a whole bunch of the low fat stuff. And that's what we do. There's a little index here. I was going to pop it up. So it's food satisfaction. And we have a problem with obesity because people are eating so much food and they're not burning it off, and they're eating so much they're eating so many empty calories that their bodies crave more of that junk food to meet their nutritional needs. And I don't know if we can pop up this. This was the 18 most addictive foods. So we can kind of scroll down this. These are foods that you just want to eat over and over again. Why does your body crave these foods so badly? Is because they're probably not providing you a lot of nutrition. And I would make the same case for whole milk. Wholesome food is great. We're just sort of corrupted with all and they put ingredients in these foods to make them palatable and addicting, and chocolate, of course, chips, cookies, ice cream, French fries, cheeseburgers. Yeah, these are all foods you just can't get enough of. And I don't know anybody who just says, gosh, I can't get enough whole milk. I need to drink 10 glasses of it. Usually you're one and done. So
Yeah, I like that number one is number one least addictive food is cucumbers. So yeah.
Right. Yeah, that's the foods that provide the most satisfaction. But I don't know. I saw a list a long time ago. It got down to the nitty gritty, like Snickers bars, and just these are things just that provided you such little satisfaction. And that's why you crave them. Sugar is a big problem, right? Sugar doesn't really supply you with a whole lot of energy, and it fills you up. Well, actually, it doesn't fill you up. You can eat a lot of it, and that's why you get fat, because there are calories there. So all good things to think about. I'm glad this stuff is back on the radar. We're discussing it. We're taking a look at the school lunch programs and nutrition for kids. Years ago, when I worked as a reporter, I was covering, I don't know, do you remember Michelle Obama was doing some stuff with school lunch programs? And I was doing a story on this. We went to a school watching, I think they had to put apples in all the school lunches. And we got pictures of the kids just throwing the apples in the trash.
I've seen photos of just overflowing trash cans with healthy food.
Yeah. And apples are a great fruit because they're not perishable. They're crispy. They're not over sweet. They're not juicy. There's just I don't know anybody who would dislike an apple, but our kids are not used to eating apples. And I would hope that we get back to some of these wholesome products like whole milk and apples and, have healthier kids. All right. Well, I think we're going to leave it at that. Thank you so much, Devin, for joining us this week. And maybe next time we talk, we'll know a little bit more about healthcare reform. The big, beautiful bill will be neutered and on President Trump's desk, and we can discuss that. Be sure to check out Healthcare News, which you can find on heartland.org, and the healthcare blog at the Goodman Institute website. It's called, if you Google Goodman Institute Health Blog, I'll put in links to our podcast description. But Devin's always writing about a ton of stuff, and it is a great thread of all the healthcare news that's going on. We just pick a lot of the topics that are listed on there to chat about. So if you want to stay well informed in healthcare, check out the healthcare blog, and then listen to us to get the free market perspective on stuff covered in the mainstream media, and tune into Healthcare News, and you should be pretty well informed. So in the meanwhile, stay well, stay safe, and thank you for tuning in, and we'll see you back here in a couple of weeks.